What we have done at Lambda is that we have developed a rehabilitation robot for the lower limbs that you can see here in this video. The idea is at the end of the day to help people after their stroke to recover and to relearn how to walk. And here what we've done is that we have developed a specific robot that can help on part of the movement by improving just maybe the movement of the hip, the movement of the knee and so on, in order to see the effects of this improvement at the end of the day in the walk. What we use in neurorehabilitation, probably most of you are have more knowledge than I have on this. This is the neuroplasticity. This is, as I understand it, as an engineer, the ability of the brain to find some new neuronal networks in order to be able to initiate the movements that are not anymore possible by moving those motor programs in another part of the brain that was not damaged. And of course, this neuroplasticity is not something that Lambda invented. This is, it could be God or the evolution, depending on your conviction. But what we do here is to provide a tool for patients and physiotherapists in order to take the maximum amount of benefits of this neuroplasticity. And we do that by increasing the intensity of the treatment, by starting the mobilization earlier. All the current guidelines agree on that. We can provide more repetition because of the robotic structure that is never tired, and we provide functional movements in order to for the brain to see that it has an effect, not just pushing on a machine. So let's talk a bit of VR because that's the subject here. We have developed a few virtual environments that could be used in perfect symbiosis with our device. The idea here is to just provide a virtual environment for the patient to train. He can, for instance, walk in a forest and collect some object. He can also drive a car, drive a ball, drive a spaceship. You can imagine a lot of different applications for the future. But the idea here is always to give the maximum amount of feedback to the brain. And in our case, what is really the key innovation is that we have this haptic feedback. This haptic feedback is possible because of the high quality of the robotic structure that we have developed here. This is a parallel robotic structure. It means that it has a high dynamic and it can really interact fast with the patient. And the other key point comes from a force sensor that we have placed at the interaction between the patient and the robot, which means that we can really precisely measure the interaction with the patient and give a perfect haptic feedback. So here we have closed the loop, if you can see, because the patient has an effect on the virtual environment, and this virtual environment has an effect on the legs and on the proprioception of the patient. And we provide the three main feedbacks, the three most important ones in virtual reality in order to really immerse the patient. We provide, of course, the first one, which is the visual feedback. The second one, that is auditive feedback. We can also add some sound. And what I said, the new one that is not really used today in neurorehabilitation, the haptic feedback. And if you bring those three feedback in a coherent way at the same moment to the brain, you can have interesting effects. So the technical problem here was to have all those feedbacks in a time frame that is less than 20 milliseconds in order for the brain to don't see the effects of the lag. What we also use in our device are the well-known mirror neurons. That's also probably a few of you know better than me. But the idea is that some of those neuronal networks are activated when you realize a task or when you see somebody realizing the same task. And what we use usually in virtual reality is that we place a virtual limb in the virtual environment in order for the patient to think that his limb is moving. One key point with our device is that you don't need to represent a virtual limb because the patient can already see his own limb moving. So at the end of the day, you don't need to represent it because he just has to focus on his own limbs. And because you move his legs, he can already activate the mirror neurons by looking at his own legs. So for the future, we have developed a few more applications. One that you can see here. The idea is that the robot is totally free, and the patient has to reach different goals in the virtual environment. And you can just reach goals like this or articular goals like you can see on this video. And the idea is that the robot is transparent, but just take the legs, just the weight of the legs, and the difference of force that is given by the patient gives him the ability to move his legs. And I always like to finish my presentation on this slide because this is one testimonials that we had from one of our patients. And I'm always amazed to see the effect of this neuroplasticity and the courage of our patient, because this woman on the right here had a stroke 20 years ago, and she had no improvement since maybe 15 years. And in just a few weeks, we saw really some nice improvement. She had improvement up to 15% in her gait speed, which was really great for us. And one thing that I always remember is that at the beginning of the treatment, she has the problem of synkinesis, which means that when we ask her to pull her leg and to try to really follow the trajectories that we are doing, she always had her arm that was rising like this at the same moment, because her brain was not capable of distinguishing those two motor programs. And session after session and week after week, her brain was capable of distinguishing and separating those two motor programs, and she was able to just pull her leg without moving the arm, which was for us as engineers really a good moment, and we can really see the effect of this neuroplasticity. And she was so happy that she even gave us a cake at the end of our clinical trials. And I always love to finish my presentation on this cake, not for you to go and grab some sugar, but to remind that what we want to do is to democratize the advanced robotic rehabilitation in order to have more and more of those kind of testimonials. Thank you for your attention.